Good afternoon, Harrin Hallway. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. You can now start your roleplay.
Hello, Mihiraa. I'm Harrin Hallway, one of the nurses here at the clinic. I can see you're looking quite tired today, and I'm so sorry to hear you've been feeling so unwell with morning sickness. Before we look at how to help you, I'd like to understand a bit more about what you've been experiencing.
Oh, thank you, Harrin. It's just been awful. I feel like I can't move without wanting to be sick. I'm vomiting maybe 5 or 6 times a day, mostly in the morning, but sometimes it lasts all day. I'm struggling to keep even a glass of water down some afternoons. Honestly, I've had to take 3 days off work this week because I just don't have the energy to stand up, let alone focus on my job. I feel completely exhausted.
That sounds incredibly draining, Mihiraa. Thank you for sharing that. When you say you can't keep water down, could you please tell me in detail about your urination?
Yes, my urine is really dark, and I realize I'm hardly going to the toilet at all. And I did feel very dizzy this morning when I got out of bed. I haven't weighed myself, but my clothes feel a bit looser.
Thank you for sharing those details. It helps me get a clearer picture of your hydration levels. Mihiraa, since you are in your first trimester, I'd like to discuss some natural ways we can try to manage these symptoms and hopefully make your days a bit easier. There are several dietary and lifestyle changes that often provide relief. For instance, rather than trying to eat 3 large meals, it is much better to eat small, frequent meals throughout the day, so your stomach is never completely empty. Many women find it helpful to keep dry crackers by the bed and eat a couple before even sitting up in the morning. It's also a good idea to incorporate ginger-based products, like ginger tea or biscuits, as ginger is a well-known natural remedy for nausea. Lastly, try to identify and avoid strong cooking smells or perfumes that might trigger your sickness.
I haven't tried the crackers before getting out of bed, so I can definitely give that a go. I do like ginger, so I'll pick some of that up. I have noticed that the smell of my husband cooking bacon in the morning makes me feel instantly sick, so I'll ask him to stop that for a while.
That sounds like a great plan, Mihiraa. In addition to those lifestyle changes, there are some supportive over-the-counter options you might find beneficial. You could try using acupressure wristbands, which are often used for motion sickness but can be very effective for pregnancy nausea as well. Vitamin B6 supplements are also frequently recommended by midwives to help settle the stomach. Regarding your hydration, instead of trying to drink a whole glass of water at once, try taking very small sips frequently or even sucking on ice chips to keep your mouth moist without triggering a gag reflex. Do you have any particular concerns or questions?
The ice chips sound like a good idea. My main concern is that I feel so bad that I just want something strong to stop the vomiting immediately. Is there a prescription medicine I can take? I just want to feel normal again.
I can truly hear how desperate you are to feel like yourself again, Mihiraa, and it is completely understandable that you want immediate relief when you are feeling this exhausted. However, it is important to understand that we generally view strong prescription antiemetics as a secondary measure rather than a first line of defense. Before we can consider those, we would need you to have a formal assessment with a GP or your obstetrician to determine if they are truly necessary for your specific situation. The reason we emphasize trying conservative, natural methods first is primarily centered on the safety of your pregnancy. During these early weeks, we want to avoid any unnecessary medication to ensure the healthiest environment possible for the baby's development. Many women find significant relief through the dietary and lifestyle changes we discussed, which carry no risk at all. How do you feel about giving these natural methods a fair try for a few days first?
I suppose that makes sense. I want to do what's best for the baby, so I'm willing to try the crackers and ginger first if it means avoiding drugs that might not be necessary. I was just worried the baby might be starving because I'm sick so much.
It is incredibly common to worry about the baby's nutrition when you cannot keep food down, but I want to reassure you that your baby is very resilient. In most cases, morning sickness usually does not harm the baby at all, and they are very good at getting the nutrients they need from your body's existing stores at this early stage. To give you some perspective on the timeline, this condition usually peaks at around 9 to 12 weeks, which is exactly where you are now. The good news is that it typically subsides by the second trimester, so you should hopefully begin to feel much better in a few weeks. Now that you know this is a normal part of early pregnancy, do you have any other concerns or questions?
It's a huge relief to know that the baby is okay and that there might be an end in sight soon. I was so worried I'd feel like this for the whole 9 months, but knowing it should get better by the second trimester makes it feel a bit more manageable. Is there anything I need to be cautious about?
I'm glad you're feeling a bit more reassured. While most morning sickness is normal, I do need to tell you when it becomes necessary to seek urgent medical attention. If you find that you are completely unable to keep any fluids down for a full 24-hour period, or if you continue to experience significant weight loss and extreme, uncontrollable vomiting, please come back to see us or go to the emergency department immediately. These can be signs of a more severe condition that requires 4 fluids.
All right, I got it.
To summarize our discussion today, we've talked about your current symptoms and identified some signs of dehydration, like your dark urine and dizziness. We've agreed that you'll try small, frequent meals, dry crackers in the morning, and avoiding strong smells. You're also going to look into ginger, vitamin B6, and acupressure bands while focusing on small sips of water or ice chips for hydration. We'll hold off on strong medications for now to see how these safe methods work, and remember that this usually improves after the 12th week. However, if you can't keep water down for 24 hours, please seek help right away. Does that cover everything for you?
Yes, that's very clear. Thank you so much, Harrin. I feel much better having a plan.
You're very welcome, Mihiraa. It's my job to help. Take care.